On a Tuesday, of course, we do our community segment with our finances, and we talk to Brother Muhammad Jaffer from Mojaf Financial Institution, or Services rather, and obviously Brother Abdurrauf Hanslow, my co-host for the segment. And last time on this particular segment, we unpacked how to approach an advisor when choosing between medical aid, medical insurance, hospital plans, health insurance, all the works, and we went through the key questions to ask before signing up. Now we're going to continue that conversation this week. We're going a little bit deeper into what all happens after the first meeting. How do you know your advisor is really giving you the independent advice? What's the smartest way to compare plans? And also, how can you make sure your cover grows with you as your family and incomes change? Whether you're reviewing your current policy or signing up for the first time, today's chat will definitely help you make informed, confident decisions about your health cover and your financial future. Joining me now on Zoom is both our brothers, Brother Muhammad Jaffer and Brother Abdurrauf Hanslow. Gentlemen, assalamu alaikum wa rahmatullahi ta'ala wa barakatuh.
Wa alaikum salam wa rahmatullahi wa barakatuh. Mikhail.
Alhamdulillah, it's good to hear your voice, Brother Muhammad.
Alhamdulillah, likewise.
Where's Brother Abdurrauf?
And
Yeah, sorry, my mic was on mute. Because I was so shocked because when I looked to my left on the Zoom, I thought Muhammad was in Johannesburg, but I see him sitting by the beach.
So I have to see this for myself here.
Well, Mikhail, it's not what you guys thinking. I'm actually in a boring place called Johannesburg. I came up for the financial planning conference, and it is all about upskilling ourselves and learning more so that we can give good, solid advice to our clients and to the community.
Fantastic.
So I must just very quickly just tell you that, alhamdulillah, this year the conference actually focused on two aspects, and one is AI in financial planning and technical systems within financial planning. And these are all tools that we as advisors must use to give our clients proper and quality advice.
Now, I'm excited to continue the conversation around medical aid simply because it's I forgot, Abdurrauf, you had a very good analogy last week that it's slipping my mind now, but I can remember it for a little bit. So can you just maybe remind us, for the listeners maybe tuning in, what was that saying that you had about medical aid last week?
Which one? There's quite a few.
Okay.
In community finance, we say prevention is better than cure because the cure is not covered anyway.
There we go. That's the one.
I think that was the one, eh?
Yeah, that's the one.
But Mikhail, before we go on, I think there's a little bit of a crisis from last week that we need to address.
Of course.
There was we received a bit of I don't know if it was a compliment or whether it was what it was, but I think we need to address it because apparently there's a question that came through, and they say the listener very profoundly said that the two old men on the radio was discussing something about medical aids last week. So I think that is definitely something we need to address. Not the medical aid, the old men.
The old men.
We're definitely not old men. But let's crack on. I think, Mikhail, you started quite well where you touched on let's just quickly recap. The first point we touched on last week was what type of cover do I actually need?
Yes.
Medical aid, hospital plan, or health insurance. Covered that. Then we said what are the monthly premiums and how do they increase each year?
Yeah.
Then what benefits are included and what are annual limits? We spent quite a bit of time on there. And then which hospitals and doctors are covered, particularly if I take a network option.
Yeah.
So we covered those 4 points. Hopefully we can cover at least another 4 this week, We will start then with what are co-payments or gaps in that I might face.
Okay.
Now, even top medical aids often don't pay the full doctor or specialist bill. And you need to know when you have to pay the extra and how much. So, and again, we will talk again. We will have a separate program on gap cover.
Okay.
But I just want to make, sometimes there's a misconception that people believe that if they've got savings attached, a medical savings account attached to their hospital plan, that they've got the old traditional medical aid. No, you don't.
Yeah.
You've got a hospital plan with medical savings that's attached to it. Once the medical savings is completed, it's used up, you have to pay out of your pocket. But just remember, the medical savings account is your money that you've paid over to the medical aid or the provider. The only real benefit that you have is that medical savings account is available to you right at the beginning of the year, even though the premiums are paid over a 12-month period. I hope that's clear.
Yes.
So what quite often happens is that the vast majority of specialists today charges above the medical aid rate. I have yet to see. There's very, very few doctors that still charge medical aid rates, which is 100% of medical aid rates. So they normally pay 300, charge 300 or 500.
Yeah.
And as I said last
Yes.
time, that even I've seen a bill even higher than that.
Yeah.
So you must make sure that difference is going to come out of your pocket. So many a times people don't. They just go and they tell the doctors that, yes, I've got a comprehensive medical aid. Now, look, I'm not saying all of them. I'm not saying that, but there is this whole thing that medical facilities and providers is running a business, you know. And if you're not going to look after your medical savings account, that account can be depleted very, very quickly.
Yes, 100%.
Abdul Rauf, I don't know if you want to add to that.
Yes, Mohammed. You know, when we speak about the network doctors and the network hospitals, the one thing that and you know, most programs that we have nowadays, there's one line we always state, and that is keeping up with the Joneses. And when we choose medical aids and when we choose our medical cover or our treatment, then also, you know, because of status, we tend to choose hospitals and we tend to choose covers that's going to give us a status. I will go to a hospital because everyone knows that hospital pays 500%, whereby certain medical aids do cover within network. With network hospitals and network doctors. So in those cases also, one should, instead of looking at choosing medical facilities or medical treatment based on status, rather choose based on necessity and health and affordability.
Yeah. And I think that's
important.
Yes.
Very important what Abdul Rauf has said for you. So people just need to make sure that they understand that the extra that has been paid from your hospital plan, it doesn't come from your risk cover within the hospital plan, but it comes from your savings portion. So it not directly and indirectly you are paying for it because that's your money that is sitting with the medical provider, with the let's call it the hospital plan or the medical aid. So take note of what is being paid from there. All right.
Yeah.
So the next point that we would like to cover is, and I think we touched on it last week, are there waiting periods or exclusions? Now, in fact, last week we had an incident at the office where the consultant on the other side gave one of our admin people a wrongful information.
Okay.
Now, you need to understand that even these people sometimes, you know, you're dealing with a call center, and sometimes, unfortunately, even they make mistakes.
Yeah.
So make sure that when you speak to your advisor, and that they know what they are talking about, and they put things over to you that you can understand and make you understand what it all means.
Okay.
Now, when you join a medical aid or a hospital plan, as I said before, that they have to take you. There's no such thing that they can't, that you are too sickly or you're an elderly person, or they have to take you. However, they can give you what they call a 12-month general waiting period for specific, a specific 12-month condition-specific waiting period.
Yeah.
So what does that mean? You know that diabetes, hypertension is very, very common in our community.
Yeah.
So if you've got that, they're going to give you a 12-month waiting period for that condition and associated conditions. Meaning that if you've got hypertension, that they're going to also that include your heart. Love forbid you get a heart attack or anything to do with your heart, because it's associated with hypertension. So those things are very important to understand, that those conditions will be, there will be a 12-month waiting period for that specific condition. But if it's something else, Allah forbid, if it's cancer or something like that, you are covered.
Okay.
The other thing that they can do is to give you a 3-month general waiting period. Now, here's also some confusion. Those general waiting period pertains to if there's any planned procedures. Those general waiting period doesn't include particularly, now there's two different things that I'm going to talk. When you move from one medical aid to another, and there wasn't a 3-month break between moving from one medical aid to another, then that 3-month general waiting period will only pertain to conditions that are not PMBs, as the prescribed minimum benefits. It won't include that. It will include other stuff that is outside of that, and any planned procedures. Meaning that if you are planning to have a procedure done, then you will have to wait until after the 3 months. So I hope that however, if you're going to join a medical aid and you haven't been on a medical aid before, or there's been a break of more than 3 months in your medical aid, then that 3-month general waiting period will kick in.
Okay.
I don't know if you want to.
Yeah, Mohammed. I think the key factor that needs to come out as well is honesty. So also when one obviously takes out a medical aid or hospital plan, one needs to be honest and disclose your medical conditions, and disclose the medications you are on, disclose your ailments, because once found, that can lead to massive repercussions at the end of the day, because then ultimately you entered into a contract with a medical aid fraudulently without letting them know that you have prior conditions or so on.
Yeah, and I want to just say this, like I remember, when signing up for a medical aid, when you actually sign that form, you are essentially, saying, I acknowledge that I don't, and this is truthful. So essentially, it's almost like you're going under oath. Like, you can't lie. You cannot lie or pretend, because there are actually legal repercussions that take place. People don't speak about this enough, and I'm glad you brought it up, Abdurrauf. I actually spoke to one of our attorneys about that yesterday on the show we had on Monday, that the repercussions of you actually committing fraud for medical care like that is not just it's not just a fine. You could have prison time. It's a very big deal.
You see, Mikhail, it doesn't only apply to medical aid. It applies in financial planning.
Of course,
most things, insurances, all these things. So honesty is the key 100%. When it comes to obviously financial planning. And there's no one better than Mohammed to tell us that.
Of course. So
Abdurrauf, you just actually raised another point of be truthful and honest when you complete the application form. We've had situations where people knowingly or unknowingly misrepresented certain facts. Now, when that happens, firstly, if something happens within the first year of being on the medical aid, I can almost guarantee you they're going to investigate it. They're going to investigate it for non-disclosure.
Yeah.
It's very easy to do that today. They phone Pathcare, they phone Mortons and Partners, and quickly they'll pick up if there was bloods or anything done, and then they'll phone in the doctors. And that's done very quickly. And if they then discover that you misrepresented something, firstly, they will cancel your medical aid with immediate effect, and they flag you.
Yeah.
Today, the medical aids, all these providers, they linked.
Yeah.
And once they flag you, if you now go to another medical aid, they're going to be very, very, very careful by accepting you as a member. So, there's no place for you to lie. It's going to catch up with you.
Yeah, 100%.
Right. So I don't know if there's anything, Mikhail, you want us to touch on the exclusions and waiting periods.
You obviously mentioned that the PMBs, the prescribed, I think, what is a PMD? What's the term for PMD? It's a
prescribed minimum benefits.
That's the one.
The minimum. Yeah.
Yes. So referring to that, a lot of people also messaged in last week about it. We didn't get time to actually get to those questions. Someone asked, when it comes to PMBs, that is defined not by medical aids, it's defined by, I think, healthcare.
Medical Schemes Act. Medical Schemes
There
Act.
we go. That's the one. So if someone has, for example, diabetes, right? Because there's two types of diabetes. One can be developed because of insulin resistance, and another one is genetic. So someone that has one that develops when they are on a medical aid, this was the question from the listener, if they are on a medical aid for about 2 months and somehow they develop this insulin resistance and then now get diabetes type 2, they're diagnosed, would they then be investigated for non-disclosure? That was actually a question that came through. So it was touched down for a little bit. So that question came through. So is there a particular answer for that?
Okay, so it's actually a very, very, very relevant and a very important question that was asked. So we don't know, we can't see what's wrong with us, otherwise we'll all be doctors, So yes, as long as we don't know, we do the application form and we don't know we are diabetic. There's no medical history of diabetes. We've been to the doctor. We've never been diagnosed with a sickness.
Yeah.
So we don't know we have it. So you put there now. But unfortunately, 3 months, 2 months, as the question was, or a couple of months afterwards, you go to the doctor or something happens and they diagnose you with diabetes. You then go back to the medical aid and tell them that, look, you've gone to the doctor, you never knew that was the situation, but here I've just been diagnosed with that. If it's all your records are clear, probability is that they will most probably not load you or give you that 12 months waiting period.
Okay.
But that I, as an advisor, can't give you a definite answer.
Okay.
But what my advice would be to you is go back to your advisor, inform the medical aid that, listen, you've just been to the doctor and this is what you have. At the time when you did the application form, you didn't know about it. They more than welcome you. They can contact your doctor and to verify your situation.
Okay. And then another question that also came through last week's segment was, how often should we review our medical aid plan? Should we do it yearly, as obviously we know every year, certain medical aid schemes say, we're changing or the window is closing for you to change your plan. How often should we review our plan and the benefits our plan has? Should we do that often, or should we just leave it until, we're ready to change based on our family change or number?
Another very important question. What I would suggest is that when it comes to people who are sickly, I would make sure that you understand what you are covered for under your current plan.
Yeah.
Now, there are, as we've said last week, that there are certain, particularly cancer drugs, and now also if you've got internal bleeding, these biotech next generation drugs and capsules you can actually swallow today, where as you swallow the capsule, it travels through your system. And as that thing travels, it actually takes pictures of your inside.
Yes.
So these are highly sophisticated and expensive types of treatment. So there are certain plans that don't cover that. So there might be a higher plan with that particular medical aid that you are with that will cover it. So in cases like that, I would suggest that you speak to the advisor and make sure that you either upgrade your medical aid, or you need to be very careful if you're going to change to another medical aid because of the waiting periods at 3 months. And so be very careful. But make sure that you upgrade, and if you know that you're going to need certain high cost treatment. And also those changes are normally made in December of the year.
Yeah.
And it becomes effective from January the following year.
We're actually
and the medical aids, correct. And the medical aid has become very, very strict about it.
Yes.
That if you don't do it before the end of the year, in fact, some medical aids now is actually given the cutoff on the 15th of December.
Yes.
So make sure that you get your change in within the time period that is given.
Yeah.
So that is when you upgrade.
Yes.
Now, you can downgrade to a lower plan anytime during the year.
Yeah. So
I think Abdullah wants to mention
if I can just add on there as well.
Oh, go ahead.
Medical aids do communicate with one regularly.
Yeah.
And in many cases, there's changes to the rules of specific medical aids, or there's changes to your cover and things like that, and that will be communicated to you. So the important thing is to read all the communication that comes through to you, and if it is unclear to you, then contact your advisor.
Yes.
Because that communication, the medical aid will never communicate with you unnecessarily.
Yes,
so if communication does come through, it's obviously advised, please read the communication that comes through, and if you don't understand it, speak to the advisor.
I can say
and
this.
Also,
yes, go ahead, Marj. Go ahead.
Sorry, Mikhail. Also something else. And this happens. People leave these things for whatever reason. I'm not going to blame anybody. They leave it for either right in the last when people are busy closing their offices, and then they want to send in the forms. Nobody's at the office, or there's nobody to attend to the emails because the office is closed, and then they want to point fingers at the advisor or the staff. Please take responsibility. It is your medical aid. It is your plan. Make sure that you get that in timeously.
No, 100%.
Please.
And
because
I remember.
it can be, it can be. I know during COVID, and people confuse us.
Yes.
During COVID time, a lot of medical aids changed their cutoffs to like March or April of the following year.
Yes.
But that was only for those years during the COVID years.
Yeah.
But now the cutoff is for certain medical aids is the 15th of December, and some of them are still at the end of December. Make sure that you know what your cutoff is. If you're not sure, phone the medical aid or phone your advisor and get the cutoff dates.
Yes, definitely. And I can speak out of experience because with the medical aid I used, or I still use, the time to upgrade the plan, you can choose the upgrade any time in the year. The cutoff is December 15th. So you can upgrade it any time in the year, but it will only take effect from January the following year. However, there are situations where I think it's in June, in the middle of the year, where they do exception changes based on exceptions. So you can go to them and they have a window for exceptions. So there's a window for exceptions in June for some medical aids. I can't obviously say which one, but if you know, you know. And in June, they do an exception review where it's like you can go to them and say, look, I've had this plan for X, Y, and Z. I'm looking to upgrade the plan. And then June would be your window. There's obviously some extra. I know because I did it myself. When my son was born in June. And so because he was born, we required, some extra funds on the medical aid essentially, and some extra coverage for a certain hospital. And so we went through the process. Alhamdulillah, they approved it, but it's very unlikely they'll approve it unless the situation is dire. In my case, alhamdulillah, it was a dire situation, and alhamdulillah, it got sorted. But you can upgrade your plan throughout the year, but it will only take effect from December. So don't wait until November, until the 15th of December. No one works in December after the 15th for the most part. Every big corporation company, everyone's going on vacation. So be proactive. Yes, go ahead.
Sorry, Marv, to cut in the. There's a lag in the.
Yeah, of course, yeah.
The other thing is also, Mikhail, that many offices, as you correctly said, people close and they've got skeleton staff.
Yeah.
And it's not easy if you've got skeleton staff during that period, if you're going to get now. That person who needs to attend to quite a few things. So be proactive, as you said, and get your change. If you want to make the changes, let your advisor know timelessly.
No, 100%. And just to round up my point, the crazy thing about it is that if you were to look at the plan coverage, I know with my medical aid, they announce the pricing for the new year, but they also announce changes in plans throughout the year. Like Abdurrauf said, every month we get an update to say, and there's an email that comes through, dear esteemed, client, this is what's happening. Sometimes now with the innovation of artificial intelligence, there is even a recommendation saying you've used X amount of this savings, you've been to that doctor, which is X amount of that. We suggest using through the AI, artificial intelligence, that you should try and switch to this plan. So there's recommendations now too with the rise of technology. So it's not even that difficult now. The medical aids AI service can even tell you what they think you should do based on a 6-month period of data where they've seen the claims on your account. So now they see, you're someone that doesn't go to the hospital often, but you attend the pharmacy, you might require more medical savings and not such a harsh hospital plan. The AI will recommend that for you. And I'm sure that's something you might have spoken about this weekend with you, Majaf.
Correct, yes, 100%.
So look, things are changing.
Yeah, definitely, yes, yeah. Abdurrauf, Mikhail, I just wanted to touch on something.
Yes,
I don't know
if
we touched it last week.
Yes.
With the waiting periods, we talked about the 3-month general waiting period, and we spoke about the 12-month specific waiting period. There's also another thing that they can do is to give you a loading if you haven't been on a medical aid before the age of 35.
Oh yes, they load you up.
Yeah, they load you, and there's specific brackets. If it's from 1 to 4, it's 5%. From 5 to 14 years is 25, and then from 15 to 25 years is 50%, and above that is 75%.
Yeah.
So that loading still stays with you.
Okay.
But what is very important is that you are. If you've been on a medical aid, say for instance you've been on your parents' medical aid and you've got proof of it, all right? Make sure that you keep that proof with you all the time. Your parents must keep it, because later on there could be a break. But then you can say, but I've been on my parents' medical aid from that date to that date, and here's the proof. And that will count towards the years that you've been off a medical aid. Let me explain it. You've been on your parents' medical aid for 5 years. Now you join the medical aid at the age of 40. Now you're going to fall into the 25% loading bracket.
Yeah.
If you don't declare that, but I was on my parents' medical aid for 5 years, and here's the proof. They then deduct that 5 years off the 40 years, and you're back to 35 years, which means to say you're going to have zero loading.
Wow.
I hope that is clear, Mikhail.
That does make sense.
Must I use another example?
No, it makes sense. Essentially,
okay.
It's just there's you, because of your age, you will fall into the bracket of the loading, but you have proof that you are on someone else's medical aid and there's no gap. So essentially, then the loading will then be falling away. Right?
Yeah, Mikhail, Abdurrauf, I don't know if you want to add to that.
No, I think that's quite comprehensively explained, Mohammed. I think the listeners can understand that quite easily. Yes.
Yeah, of course. Now, if there's
Okay.
any
All right.
listeners that want to message into the show, if you want your question to be read, of course, now's your chance. 0786 10 11 12 is the WhatsApp number. Send your questions in, Brother Mojaf and Brother Abdurauf, and we'll definitely get back to you if we have time, inshallah. 0786 10 11 12.
Okay. So let's move on to the next point, Mikhail.
Yes.
And that is, how does the plan cover chronic conditions or long-term medication? Now, if you have any conditions like diabetes, asthma, or hypertension, or any of those conditions that falls within the PMBs, the prescribed minimum benefits, there's roughly about 26 of them. Then, depending on the plan that you are on, they sometimes extend that 26 to 35 or 38, depending on the plan that you are on. Again, very important to make sure that your conditions fall within that. Now, once it falls within those conditions, you do qualify for chronic medication cover. And this is what they talk normally the long-term medication. Now, the medical aids has got what they call a chronic disease list. And on that list, they will have what they will pay for certain conditions, for hypertension, for asthma, for diabetes, for stroke, for whatever it is, medical condition that's on that list. So say, for instance, on that list, they've got, and what they will typically do is that if there's a generic for a specific drug, they will cover the cost of the generic. Now, you come and Mikhail goes to the doctor, and the doctor puts him onto a drug, and the vast majority of doctors still use the original drug. Now, if you're going to go and insist that you need that original drug and the generic drug costs half the price, so say, for instance, the original drug, and I'm going to just use figures to explain myself. Say, for instance, the original drug costs 500 Rand and the generic costs 250. The medical aid is most probably going to pay the 250, and then you will have to pay the gap, the difference.
Yes.
Now, many people also misunderstand this and say, no, my medical aid pays the difference. It's not your medical aid, it's your medical savings account that will pay the difference. So if you can, check with your doctor. If you can take the generic. I worked in my previous life, I worked for a pharmaceutical company.
Okay.
So I have got a good understanding of these things. So you'll find that the generics is today is very good. It's as good. In fact, in most cases, it is, once they are out of the patent period, it's actually the same chemical entity that they use.
Exactly the same.
The generic.
100%.
So, but just to be sure, just check with your pharmacist or your doctor if that is okay.
Yeah.
But so they will. In most cases, they won't cover the original drug. They will cover the generic drug.
Okay.
Abdurauf, you want to add to that?
Yes, Mohammed. That list of medications, all medical aids, are obviously, it's a business. So they're going to look at the cheapest option to give you the cover, but at the same time to make sure you get your medication. So the generics are the most probable medications that's going to be covered. But there's one other sector also, Mohammed, and we had someone in our family that was ill a few years ago, and there was state-of-the-art research medications that was available for the treatment of the ailment. The one thing we have to remember is medical aids do not pay for research medications.
Yeah.
So if you hear of medication specifically that has been successful in the treatment of whatever, it doesn't necessarily mean that your medical aid or your doctor, even if he motivates, that they're possibly going to accept that. The probability is they're going to decline because it's research medications. Yeah. And there's a lot of that going around at the moment as well.
Yeah, most definitely.
Okay, thanks for that, Abdurauf. Just another thing that I just want to clarify. that when your doctor puts you onto, say, for instance, a cholesterol-lowering drug, all right. Now, the doctor or you need to register that drug or that script with your medical aid before it will be covered. So, say, for instance, your doctor puts you onto a cholesterol-lowering drug, and you just take the script and you go off to the pharmacy and expect the medical aid to pay for it. It's not going to happen. You need to get the doctor. Most of the doctors today, their receptionist is linked to the medical aids directly, and they can load the script and put the application in for a certain drug. And many of the medical aids today are very thorough. They would want to know why the doctor's putting them on there, and they want justification. And for I believe it's the right thing to do also, So once that is approved by the medical aid, they will pay for it at their rate. But don't expect the doctor's given you a script and now you're going to go to the pharmacy and get the script. It's not going to happen. And then people complain, yes, the medical aid didn't want to pay and this, that, and the other. There's a process that we need to follow.
Yeah, no, 100%. And a lot of people sometimes forget about that medical aid doesn't simply mean that you're going to get everything that you want if you're sick. You still have to read the fine print.
Correct. It says medical aid. It covers, it aids you.
Aids you, yeah. It's not medical protection. Not medical protection, it's medical aid,
yeah. Look, and you know what, the important thing, we're making light of it, it's Mikhail, but it's good, but people must understand that if the medical aid, you must understand that they are trying to protect their pool as well. If they're just going to pay left, right, and center, what's going to happen to our increases every year? That's why there are certain medical aids that we are now quite involved with that has had an increase of between 4.6 and 5% for the last 3 years, Mikhail. Compared to the industry norm of about between 9 and 12%. And that is because they are strict with they just don't just approve and, because at the end of the day, you're going to pay for that.
Yeah,
I think also, Mohammed, if one looks at the old comprehensive cover compared to the new comprehensive cover now, then medical cover where comprehensive means mostly not. So you're not mostly comprehensively covered. So you have to be very careful in how you approach things, because there's medical aids, the traditional medical aids are non-existent anymore. Whereby, in the old days, Mohammed, in the 80s and 90s, and no, we are not old. The 80s and 90s wasn't that long ago. But during that time, one could go to the hospital without authorization, and the medical aid would pay for that hospitalization. It was a guarantee. But in today's day and age, things have changed. Things have changed because everything has become far more expensive than those years in the 80s and 90s.
100% correct. So, all right, let's move on to the next one that you would like to cover. Yes. And that is, can I add dependents and what will it cost?
Yes.
So, if you're covering a spouse or any of your children, the rates differ. All right. So, a dependent can be classified as a child or as an adult dependent. So obviously the rates changes and differs for if it's an adult and if it is a dependent. Now, again, I'm not going to just blanketly say do this and do that. It depends on your personal circumstances.
Yeah.
Sometimes it is better to put certain children when they get to a certain age, to put them onto a separate plan, because you can get maybe the parents is on a higher plan than what the children actually need. Alhamdulillah, maybe the parents are sickly, so they had to go on a higher plan. But the children are okay. They find they're young. So they might not need a comprehensive or a classic plan or a higher plan. They might need a entry-level plan. that's just going to cover them in the case of sports injuries and things like that. So these are discussions that you need to have with your advisor. And the same with if you're going to add adult dependent. Sometimes it is actually cheaper for you if they go onto their own medical aid. Again, it can be a cheaper medical aid than what you are on. So again, here you need to get proper advice before you decide what you're going to do. And compare and let the advisor work it out for you and things like that, particularly when it comes to loading. And again, the loading, think it through properly. Was I on my parents' medical aid before, or I was on my spouse's medical aid before, and he's passed on or she's passed on? Make sure that you know those facts, and give those facts to the advisor when you sit down with the advisor.
Yeah.
Dr. Rolf, I don't know if you want to add to it.
I think also, the same applies to the main member. We spoke about the honesty factor earlier on in the program. This applies too when it comes to your dependents. In fact, you have to be very, very detailed in everything as far as the cover is concerned. If there are any underlying medical conditions, forget or I don't know is not an excuse. If there is a record, then that obviously is a problem.
Yeah.
So there as well, we have to be honest when we're loading our dependents as well. And Mohammed, I think maybe also when it comes to the adult dependents, at the age of 21, there's certain circumstances they can remain on the parents' medical aid, and in certain circumstances they have to be removed. So I think only students, if I'm not mistaken, if there are students
there are certain, you're correct, Abdul Rauf. There are certain medical aids that allows the children after the age of 21 to stay on the parents' medical aid. And there are other medical aids that will say no, when they reach the age of 21, they need to go on to their own medical aid. So again, it depends on who the providers are.
And that's why it's so important for financial advice and seek financial advice from a certified financial planner.
Yeah. And I think that I think the industry is becoming more and more aware of that go to people that are experienced and the necessary qualifications to do these things.
Yes,
all right, let's go to the next point.
Just to let you know, Brother Mojaf, we only have 4 minutes left, eh?
Okay, so let's just deal with or shall we rather round up instead of rushing?
I think let's round up, and then next week you can continue the conversation, because I don't want us to start something now and then the listeners are
correct, and
locked in, and then we have to rush through it because we only have about 3 minutes left. So we can round up, and inshallah next week we'll continue.
Yeah. So I think from my side, what I would just want to tell people is, with the advent of the internet and that, do a little bit of research before you go see somebody, to make sure that you understand your needs and what exactly it is that you want to be covered, so that you understand at least the basis from what you're going to ask the advisor. And then from there, don't just commit and decide that, listen, yes, that's the right thing to do. Take the information with you and discuss it with your loved ones. And then from there, you decide. Don't just rush and oh, no, that's the right thing for me and that's the right plan for me. No, it might not be once you speak to the family and things like that. The other thing is Rauf and Mikhail, please don't decide on a loyalty program, decide what medical aid I'm going to take. Please separate the two. Go there for what it is that you want from a medical perspective. The other stuff is nice to have, as bells and whistles. Don't base your medical aid on what the loyalty program is that I'm going to get.
Yeah.
It's two completely separate entities, and make sure that you get the right medical aid, not because of the loyalty program that you can get, that you're going to pay for, and which you might not use. Abdul Rauf, I don't know if you want to add to it.
Yeah, you know, Mohammed, only 15.7% of South Africa is on medical aid. But yet, 35% of the working class of South Africa are emerging middle class, earning up to 360,000 Rand. That tells me that people are still putting their wants ahead of their needs. Medical aid, unfortunately, is a need in South Africa because the state hospital care is overwhelmed when it comes to the treatment of the public. So, you know, when it comes to our emerging middle class, or even whoever that is a working person, consult a certified financial planner or your financial advisor, and find a way to budget and to save money in order to get yourself medically covered. That is vitally important in South Africa. It's one of those needs that really needs to be taken into account when living in South Africa.
Okay. I think that's a really nice way for us to wrap up the show this evening. But like I said, next week, inshallah, we'll definitely continue the conversation. I've benefited a lot from this conversation, and inshallah, the listeners did too. Gentlemen, shukran so much for being with us this evening, and we'll talk soon again next week, inshallah. All the best. Assalamu alaikum.
Wa alaikum salam wa rahmatullahi wa barakatuh.
That's right there, the voices of my co-host for the segment of Community Finances, and that is Brother Muhammad Jaffer from Mojah Financial Institution, or RISO Services rather, and then of course Brother Abdul Rauf Hanslow. And apparently this show is older than me, and it's been around as long as I've been around on earth. So alhamdulillah, we'll continue that show again next week, inshallah. If you found it beneficial, alhamdulillah, if you need to ask questions, you can also send it in, and you can say this is for Community Finances, and we'll definitely save the questions and put it forward to the brothers next week, inshallah. But now we're going to take a break for the newsroom to round up the news at 7 with Khadija Davids, and then after that we're going to break for the waqt of Maghrib. The adhan is at 90 minutes past 7 this evening, and then we'll come back for our international speaker. So stay tuned to Radio 786 100.4 FM.